Good morning, everyone, and thank you for joining us today. We're going to get started in just a couple minutes, but first I just want to go over some basics of this webinar. First, you should be able to see a chat button, a raise your hand button, and a question and answer button at the bottom of your screen. At any time you have a question, please feel free to fill out in the chat button or in the question and answer button, and we will answer them at the end of the webinar. The raise your hand function can be used as well. Dr. Moon, you can use that to encourage some participation. I will go ahead and introduce Dr. Moon and then we'll get started. Dr. Moon is one of the original founding partners of Nittany Eye Associates and has practiced for over 36 years. Through the years, she has been recognized and has won numerous awards, including more recently, the Presidential Medal of Honor by the Pennsylvania College of Optometry at Salus University, and the Dr. H. Ward Ewald Meritorious Award from the Pennsylvania Optometric Association. This is the organization's highest award. Dr. Moon's special practice interests include geriatric, pediatric, patients with special needs, and all vision rehabilitative care. Thank you, Dr. Moon, for joining us today, and you may start.
Thank you, Rachel, and thanks for everybody for attending. I have a lot of information here, so I think we'll hold questions to the end. So let me get started here. This is the standard disclosures that we need to make when we're doing presentations. So a standard honorarium is accepted for some presentations I do. I do provide consulting services to various agencies and organizations. I'm also currently a board member of the National Board of Examiners in Optometry that does the exam writing for future optometrists. And I'm a peer reviewer for 3 workmen's compensation organizations. I do not have any financial support from any industry or optometric labs or pharmaceutical companies. The other disclosure, and Rachel, I'm glad you're here to help out. I'm semi-tech challenged. I know what I need to know. And you know, another good one that goes along with regard to what my philosophies with regard to this. I don't know everything, so I don't need to know everything. I just need to know where to find it and when I need it and who to ask as far as my office staff is concerned. This is sort of a philosophy that I work on, and I preach to the externs that study under us. Doctors don't know everything. Doctors need to be humble and keep an open mind and be willing to learn. And one of the things that I tell the interns that come in our office is, if you get to a point that you think that you know everything, you need to retire and get out of the profession. So let's get started. What is low vision? And it's a visual impairment that causes you to need more than just eyeglasses or contact lenses in order to read, to be able to drive, or do other everyday tasks. Low vision is very frustrating. It's a very limiting condition, but with correct treatment, there is hope. Success rates, depending upon the diagnosis and how much vision is remaining, is about 80 to 85% of individuals were able to get to do things that they couldn't do before. Low vision can affect the side peripheral vision and also the central vision. People may see dark spots or wavy lines, especially in wet forms of macular degeneration, which we'll talk a little about. You can have blurry, fuzzy, or double vision, or you may experience trouble distinguishing details in low light or when there's poor contrast, and we'll get into more details with that as well. So what causes low vision? I mean, some people can be born with it, but in most cases, it's something that develops as time goes on, many times by health conditions, one being diabetes. We're just going to hit the most common conditions that can cause vision loss. There are a lot of different conditions that I see on a day-to-day basis that result in low vision, but we're just going to get the highlights here. Glaucoma, I mean, Dr. Simber did a presentation a few weeks ago. It is up on our website if you'd like more information with regard to glaucoma. I'm just going to go over the basics of this just to get everybody who wasn't on that up to snuff. But it is a serious condition that left untreated can cause blindness. The most common type of glaucoma is what's called a primary open-angle glaucoma. It's basically a plumbing problem with regard to the eye. The damage occurs to the nerve because there's a change in fluid pressure. Anywhere along the process, if fluid builds up in the eye, it cuts down on the blood supply to the nerve tissue, and the nerve starts to go dead. The problem with regard to glaucoma, there's not a lot of signs or symptoms in the beginning stages of it. There's no pain involved with regard to it, and it gradually causes a narrowing of the visual fields on the side, causing a tunnel vision effect. And so by the time it gets to that particular point that a patient notices that, it's pretty advanced. So regular eye examinations and monitoring of the condition is the best way to pick up any of that occurring. And this is a simulator of what tends to happen. I mean, an individual for the most part can see pretty well straight ahead, but this tunneling starts to occur. And then we can have what's called an arcuate or a curved scotoma in the center of the vision that can pop up. But as you can see, an individual can still see pretty good detail straight ahead. Next common eye condition that can cause low vision is age-related macular degeneration. Several weeks ago, Dr. Russell did an excellent presentation in this, and I would encourage you, if you want to know more information, to go to our website, and you'll see this presentation as well. It most commonly occurs in individuals over 60. It's more common in women. Women are about 3 times more common than men to develop macular degeneration. There's usually no pain associated with this, but it definitely reduces an individual's quality of life. It becomes difficult to recognize people's faces. It becomes difficult to distinguish medications, read mail, read the newspaper. Normally in the beginning, it may just be a slight blurring of vision, or in the beginnings of wet form of macular degeneration, straight lines may look wavy or curvy. But as the macular degeneration progresses, the blurred spot in the center of the vision makes it very difficult, as I said, for reading and recognizing faces. And this is a simulation from the American Foundation for the Blind that shows what happens in the dry form of macular degeneration, which Dr. Russell went into. This is a very gradual process that occurs. Wet can occur much quicker, but as you see, the side peripheral vision is still there. So sometimes this is difficult for individuals to know because an individual is able to walk around fine, but they can't recognize somebody's face or be able to read things. This simulates an individual that's having some wet form of macular degeneration. Not only do you have the central blind spot scotoma, but as you see on the sides of the bridges, it's wavy or curvy, and that's what happens in the wet form. Diabetic retinopathy is another very common condition that we see. Diabetes affects the inner lining of the eye. It is the leading cause of blindness in American adults. It affects about 1 in 4 individuals living with diabetes. What happens is the small blood vessels tend to leak and bleed in the retina. And we have 2 different groups of blood vessels, one on the top surface of the retina, the inner line of the eye, but we also have a deeper one that's 10 layers down into the bottom. And we do have techniques in our office to be able to do angiograms, which both Dr. Russell and Dr. Simber talked about, that we're able to see those hidden blood vessels. Management for the condition is basically controlling the diabetic condition the best that an individual can, keeping their blood sugar levels and their hemoglobin A1C levels in the recommended ranges. But if the retina is involved, then sometimes laser treatments or injectable medications are sometimes needed by a retinal specialist to treat the condition. And this is a picture that is an individual that has pretty significant diabetic retinopathy. Just to orient, this lighter area here is the optic nerve. These are blood vessels that curve up, that come up from the internal carotid up your neck, and then they branch through the eye. So it allows us, the eye is the only part of the body where we can see blood vessels and nerve tissue under its natural state. But this is blood that's leaking out. These are exudates. These are areas that there's been ischemia and some waste deposits left behind. And then what happens is this macular zone, or the central sweet spot bullseye of the eye, starts to become swollen. and that's when that vision starts to be affected. So this is a pretty advanced case of diabetic retinopathy. And the other condition I'm going to touch on a little bit is traumatic brain injury or strokes or cerebral vascular accidents. We can have significant vision loss or low vision in such patients that manifest this. It can cause a partial loss of vision depending upon where the insult occurs in the brain. I mean, to go from the eye all the way back to the occipital or back portion of the brain area, those fibers pass through about 65% of the brain tissue. So depending upon where along that process, either the insult to the brain occurs will dictate how much vision and what type of vision loss occurs. It can be side vision that's lost. Individuals can have difficulties focusing on things. They may see two of things and have the double vision. When we get into the vestibular system, they may also have dizziness and vertigo, and light sensitivity is a big one in traumatic brain injury that continues to last even after they've had the insult. In some cases, the brain is affected in a way that can cause confusion between knowing left and right, and trouble navigating even in familiar areas, and even sometimes some visual hallucinations can occur. So this is a schematic to show that anywhere along this pathway, this is if we're looking down on the person's brain area, and this is the left eye, and this would be the right eye. And so the fibers come back through here. They cross over in the chiasm under this area is where the pituitary gland is, comes back each side, and then gets back to here where the occipital cortex is. So anywhere along this pathway area can give us a different kind of visual field loss. Like for instance, if the area isn't where the crossing area is, an individual has the side vision, half of the side vision is missing. And that's very common in individuals that have a pituitary tumor that may occur. If it's more in the back area, in the back right area of the occipital cortex, it's going to be the right half of the visual fields are missing or gone. So we can pretty much get an idea from our visual field testing instruments to get an idea where the insult is. And then I myself like to confirm it by having radiology summary sent to me for review. And same thing too with regard to an individual that has a stroke. These are blood vessels. This is if we're looking underneath the brain area and looking up on it. So a lot of these areas, like for instance, the third cranial nerve feeds the eye, the sixth cranial nerve feeds the eye, the fourth also goes to the eye. And so any of these blood vessels along this way that would hemorrhage or leak can cause damage to those respective nerves and impact the vision. So let's talk about individual has those particular conditions and they get to a point where their visual functioning has been compromised. So that falls under the category of low vision rehabilitation services, and they're typically provided by an optometrist that is a low vision rehabilitation specialist. And that is one of my specialty areas that I work with. So it's a different type of examination an individual goes through than when you go in for a general eye examination to your optometrist. And so we assess a lot of different areas. We'll assess a patient's current level of visual functioning. Now, I'll ask patients what their needs and goals are. We'll also examine the patient's eye condition. We'll do a comprehensive eye health examination, and then we'll evaluate a patient's performance with various low vision rehabilitation, vision enhancement device options, which may include some magnification and may also include non-optical devices, filters, sun lens evaluations, a lot of different things. And then we'll make recommendations for additional vision support services. This examination usually takes about 1 to 2 hours, depending upon how great the individual's needs are and how severe their visual challenges are. And we'll break down some of the options that we have here as well. There's optical devices, there's non-optical devices, and then there's also supportive services. And all of these are important. So optical options, they may be a handheld or a stand magnifier. Some individuals already come in starting to utilize some of those. Some hand magnifier that may have handed down to the individual, or they may have got at a hobby store. But those are usually lower amounts of magnification. When we get to certain higher levels, then they become more into the prescriptive levels. Microscopes or magnifying glasses, telescopes to be able to see better far away, or telemicroscopes that can, some of them have features of far away and up close, or specific working distances for specific tasks up close. And then electronic magnification devices, sorry for my misspelling there. That is one of the areas that is probably one of the fastest growing with regard to helping individuals that have low vision. This is a summary of some of these devices I was talking about. This is a handheld magnifier that has a light in it. A lot of times what we have with individuals that have macular degeneration and diabetic retinopathy, they just need a little bit more light in addition to magnification. Sometimes if an individual has a very unsteady hand, we may use a handheld stand magnifier. It sits right onto the page. Let me go back here. And that helps to steady that. This is another handheld magnifier. It's a little bit smaller, sometimes a little bit easier to put in a pocket or a purse. This is a microscope where an individual will hold materials closer and it enlarges, magnifying glasses. And then this is a telemicroscope specifically for certain tasks that an individual needs to do at certain working distance. So this is an individual that's using a pair of microscopic glasses. As you see, based upon the level of the magnification, the working distance needs to get a little closer to get into that sweet spot of where things are clear and magnified. And these are some of our distance options, a little spotting telescope that has a zoom feature in it. This is a popular one, sport glass telescopes for individuals that want to watch television or see sporting events, and another focusable spotting telescope as well. This is a SmartLux, which was one of the many electronic magnification devices that are out there. This is one of the smaller ones. Nice thing about this is it's easy to hold. It can sit right down on the page. You can change the background. We talked about before, contrast is a big thing. So some individuals, if they have glare issues, they'd rather have a black background and white print. It can also change the color of the print as well. So you can have a black background and yellow print. There's a lot of different options with this. And it also can change magnification. Like for instance, in a person that has diabetic retinopathy or diabetes, their vision may fluctuate. So one day they may need to enlarge things 4 times its size, and the next day it may be a bad day and they may need to enlarge things 10 times its size. So some of these devices, as opposed to a fixed focus handheld or a stand magnifier, these have these options to be able to do that. They can also freeze frame, so you can take a picture of something. Say, for instance, if you're cooking, you need to take a picture of a recipe and then bring it over closer to where you're trying to make the prep. So there's a lot of options that are available with these electronic devices. And this is just one of many. This is a little bit larger electronic magnification device called a closed circuit television, a CCTV. Printed material is put down here and it enlarges up here. Just like the handheld one, it has variable background and print options. It also has variable sizes. This is one of the simpler ones to use. The knobs are very easy to feel and to see with the different features. This affords an individual, if they have a lot of handiwork to do, they're able to write under this, they're able to paint under it, they're able to see to thread a needle, and it projects it and magnifies it up on the screen here. So a lot of different options that are available with the electronic devices and the closed circuit television option. And we talked before that individuals can have some glare, light sensitivity issues. This is an area many times that is under-addressed with patients that have low vision and certain types of conditions. This filter over here that is more of a purple coloration. We find that that's working very well with some individuals that have concussion or the milder forms of traumatic brain injury. Down here with the amber, that tends to work well for individuals that have macular degeneration. Sometimes typical pairs of sunglasses are actually too dark for them, but they need something to cut down on the glare. So that works out very well. And a lot of times individuals also have side glare issues. And so you'll see many of these have a side shield to them. And then individuals that have severe amounts of light sensitivity and glare, this is a polarized form of sunglasses that have a wrap that work out very well for the individuals that have a higher level of glare light sensitivity issues. So we actually have our patients go through an evaluation process to see which intensity, which coloration works better for them. They may need something for indoors that doesn't work as well for outdoors and vice versa. So we're assessing patients in all different kind of conditions. Non-optical device options. There's many out there. Even just changing or increasing the print font size on an iPad or on an individual's phone. Enlarged print. Reader's Digest is a very, very popular publication out there that is enlarged print. Reduction of working distance. If an individual has a difficulty seeing a television, just physically getting closer to it. So just rearranging the furniture in the room instead of sitting 10 feet away. If they get 5 feet away, many times that's enough for them to be able to see the writing on the TV screen or an individual's face. And the same thing with regard to up close activities. If an individual brings something just closer to their face, it enlarges and it's a little bit easier to see. Audio books and materials are out there as well. Task lighting. Many times, especially with macular degeneration and diabetic retinopathy, it's not enough just to have a ceiling light or a lamp that has a shade on it, but shining light with a gooseneck lamp directly on what a person's trying to see will many times enhance their vision, that they're able to see 2 or 3 lines better on the visual acuity chart and therefore be able to see 2 or 3 lines smaller in printed material. Clear yellow acetate overlays for enhancing contrast also help as well. And that's one of the things we have here. If you look at a little catalog here, and the printed material where the yellow acetate appears to be darker and bolder. It's not necessarily larger, but it's just darker and bolder than it is on the part that is not does not have the overlay on it. And so something just as simple as that can make a difference for a patient that has low vision. And then of course, as I said, the large print materials and a gooseneck or a task type lamp, positioning it in a position where they get the direct light, but they don't get the shadowing. Other non-optical options are signature check writing guides, having bold line paper, utilizing a Sharpie marker, a dark marker that just has a bolder tip to it, and then enhancing contrast by using different colors of plates, food, and placemats. And what I mean with regard to that, say you're serving mashed potatoes and chicken, and they're lighter in color. So if your mother has severe macular degeneration and it's difficult for her to locate where her food is on the plate, if you put those mashed potatoes and chicken on a darker plate, like a navy blue plate, and then put that on a lighter placemat, that contrast is many times a very big helper to be able to assist the individual with that. So these are some options as well, as I talked about, the Sharpie that has a bold tip marker and it's dark. Black on white is a very high contrast for individuals to see. Checks, you can also get checks that are also enlarged, but these little check writing guides fit actually over here, so they don't have to see where the line is. All they have to do is just fill in the spaces there. A signature guide, and then for those that are still like to write, as opposed to send something on the computer, this is a little writing guide. So a lot of times individuals will come in and say, I really hate that I'm writing up, or I'm writing down. I can't write a straight line anymore. And that's a guide that can assist them. Other options to consider. Oh boy, there's a lot. This is an exploding area in smartphone, tablets, and iPads. There's enlarging options. There's voiceover options. There are apps to identify people, objects. You can tell colors. You can tell money. I mean, this is a lecture in itself. But there's so much in the area of electronics right now that can assist individuals that have low vision. And in fact, even in individuals that have no vision at all, it is truly, truly an exploding and amazing area. And additional support services, I would be remiss if I don't mention the other team players out there. Pennsylvania has services that are available to the citizens of the Commonwealth of Pennsylvania through the Bureau of Blindness and Visual Services. And we are set up in Pennsylvania to have several district offices. I mostly work with the Altoona, Wilkes-Barre, and the Erie district offices. If individual needs more information, they can get on the website and contact them. If you need phone numbers, you can contact my office as well. We can give those to you. But the Bureau of Blindness and Visual Services, most of the services they provide are at no cost at all. They are a government agency. Their workers are part of the Commonwealth of Pennsylvania. They're employed by the Commonwealth of Pennsylvania, so our tax dollars do pay for that service to be there. And they provide social service, casework services, vision rehabilitation, therapy services, orientation, mobility if individuals have problems with regard to traveling, job retraining and placement, educational assistance, and technical support services. So they can pretty much customize whatever your needs are. And even sometimes just trying to find, okay, I can't drive a car anymore and I need transportation support services to get me to doctor's appointments, to go to the grocery store. The social work, casework services can help with regard to that. And that's just one of many things that these individuals can do. Other support services, there are private nonprofit agencies, such as the Pennsylvania Association for the Blind. They are available in most counties. And the Sight Loss Support Group here in central Pennsylvania in Center County, we have the first Sight Loss Support Group in Pennsylvania that was founded here. And I think that's it for my presentation. And I think Rachel will go ahead and open it up to questions.
Absolutely. Thank you for that presentation. At this time, I do not have any questions listed, so we will give it a moment. If you have questions, please click that question and answer box in the bottom and go ahead and type those in for me. And we'll give you guys just a moment to do that.
I can't believe that I gave all the information so clearly that everybody was able to.
It was a great presentation, but I am waiting for questions here. Let me go see if I have any emailed to me.
Well, we got a couple preliminary ones that we took care of.
Absolutely. Oh, here's one here. It says, I support someone with occipital neuralgia. Can you explain that?
Oh boy, occipital neuralgia. Boy, that's a lecture on itself. Are you asking, is this person asking with regard to what the visual consequences can be with regard to this? I mean, some of it can be the hallucination that I talked about. Some of it can be vision goes in and out. It's very unsteady. That's sort of where we are with regard to that. I mean, as far as the specifics of it, I don't know all the details of it as it relates to any other thing other than the vision component. If you want more information with regard to that, we can get back to you with more, but that's the visual standpoint, is the instability in vision, things go in and out. It's difficult to maintain focus on things.
We've gotten, okay, right here. I have a response to that. What are the visual consequences? He suffers low vision from it.
Yeah, and that's where the big thing is contrast is going to be poor, glare light sensitivity issues are there. An individual may need some enlarging. Their vision is very unstable. It goes in and out. It's sort of like if you look through a zoom lens of a camera and you zoom it out, sometimes it comes into focus but they can't maintain it, and sometimes it goes out. They can also have some visual field loss, like if you had a pie, pieces of the pie are missing.
Are there any tools that would help with that?
Well, again, it depends upon what area is exactly impacted, as far as some individuals can have all those symptoms or some of those symptoms. But yeah, many of the things that I talked about today are some devices that can be explored with, or some options that we can explore with. I didn't even touch on the aspect of visual field enhancement and field expansion for individuals that may have some side or tunnel vision issues. That's sort of a part of a lecture on its own, and there are. So if an individual is having some issues with regard to visual functioning as it relates to day-to-day activities, I would encourage setting up an appointment to have a low vision rehabilitation consultation. And even if you're not sure with regard to that, even if previous eye records are even forwarded on, we can take a look at those, and I can get give you a pretty good idea whether the success rate is going to be pretty high or it's going to be very low.
Thank you for that answer, Dr. Moon. Next question here. Are there any differences in how things are addressed when dealing with a child who is born with low vision issues versus when caused by a disease?
Yeah, that's a very, very good question. Most of the time, the individuals that have a condition that they're born with, many times those are pretty stable. They're not something that tends to progress, as opposed to individuals that tend to have conditions that we were talking about today, like macular degeneration, diabetic retinopathy. Those conditions can be a progressive. And the other thing, when we have kiddos that are born with certain things, that's the vision that they have. And so they don't have anything to compare to. And so many times it's a whole lot easier to work with them. We have programs too, and again, this is a lecture in itself, that can start to further enhance their vision. Working with vision rehab teachers, we can start to develop many user skills of that remaining vision that we have. Now, of course, teaching them how to utilize a handheld magnifier, stand magnifier, telescope, electronic devices when they're babies, it's difficult for them to do that. But the vision rehabilitation teachers, the teachers of the visually impaired, which are called TVIs for short, they can start those developmental skills to get them to a point that then those readiness skills are there, and then we can jump in pretty early. Usually I can start working with low vision rehabilitation devices, start introducing some of those things with kids at about 3 years of age. But needless to say, there's a lot of things that can be done earlier than that.
Thank you. Are the distance sporting observation glasses acceptable for driving?
Well, that's a different situation. In the Commonwealth of Pennsylvania, the answer is no. Vision enhancement with telescopic devices are not permitted in the Commonwealth of Pennsylvania. However, there are states that do permit not that specific type of telescope, but there are telescopes called bioptic systems that are approved for driving. My first patient that actually got a driver's license was in Colorado. She actually was a resident here in Pennsylvania, but then moved out to Colorado to be with her son. And so we did all the preliminary low vision rehabilitative services and actually fit her with the device. And then I hooked her up with a low vision rehabilitation optometrist out in Colorado Springs. And she went through her final training and was able to get a driver's license. Ohio, I have a patient that, longtime patient of mine here in Pennsylvania, lives in Ohio, and he has a bioptic system that he's able to drive with as well. But unfortunately, currently right now, the Commonwealth of Pennsylvania does not permit enhancement via telescopic devices for driving.
Thank you, Dr. Moon. Next question here. What resources are used to assist reading when a macular disease, not necessarily degeneration, has limited the central vision?
Well, again, it's not too different than working with an individual that has macular degeneration or any other conditions that affect the macular central area. So basically what you're trying to do is you're trying to enlarge things around that spot that macula and utilize the rest of the retina that's still good and functioning and healthy. So utilizing it to enlarge it around that area. So it could be something as simple as a handheld or a stand magnifier, a pair of magnifying glasses that people hold things closer to get the focal point, or some of the electronic devices. So again, it depends upon how big that scotoma, that central spot is, and how much magnification demands an individual has. But yeah, very, very similar to what we deal with individuals who have macular degeneration.
Next question here. Now this one is, I think, important for the times, not necessarily related to low vision, but I think it's good to touch on. Would you please offer suggestions for Eyestrain? No medical issues, just simple computer and document increasing with telework. The increase of paperwork, digital content affect dominant eye, causing pain and headaches.
Yeah, Dr. Harsh talked a little bit about this during her presentation. And again, that's available on our webinar as well too, on our website. The big thing is, of all ages, we're tied into the computer utilization, everything from virtual school to Zoom meetings like we're doing now. The 20-20-20 rule definitely should be exercised, which is for every 20 minutes, you take a 20-second break and you look at something 20 feet away. Many times what happens, our focusing muscles get so locked in, just like if you cross your leg for too long, the muscle starts to cramp up. So that periodic, and it doesn't take long to do it, but just get in that routine about every 20 minutes to look at something 20 feet away for just 20 seconds, or even just blink a couple times to refocus things. That's a big one with regard to helping with regard to eye strain. Another thing is when we tend to stare at a computer or electronic devices or even long-term paperwork, we don't blink, and our eyes tend to dry out. So the blink squishes the tears out. Videography studies have been done at Indiana University in Bloomington and University of Houston that show that when we're doing those kind of activities, our blink rate reduces by about 50%. So we're not blinking, we're not producing tears. We tend to have tear evaporation. We tend to get some eye dryness, some eye strain. They feel sandy, gritty. So remembering to blink, also taking that 20-20-20 break, and having some artificial tears, eye lubricants beside you if you're going to be on the computer for a long period of time. Periodically utilizing those drops will help as well too. Changing contrast, changing the illuminance of your device can sometimes help as well too. So those are a couple quick things that will help of all ages and all levels of vision to assist with regard to the light sensitivity, glare, and eye strain that a lot of us are manifesting right now. There's also available too blue light protection. Some devices are built in. I know some of the newer iPhones already have it in, and then you just go into the accessory and set it. But it's also a tint that's available, or even some ready-made glasses. I know we have in our office the Polinis that have the blue light protection on it. That also helps to cut down on some of that eye strain as well. I'm wearing progressive lenses, photosensitive transition lenses, and it also has a blue blocker in it as well too, because if I don't have them on, it makes it, I feel my eyes starting to strain a little bit more if I don't have that coating on there and that filtering. Hopefully that helped to answer that question.
Yeah, thank you, Dr. Moon, for touching on that. And we do have those blue light glasses actually available online now. We have a couple options where you can purchase them online. So if that's something you're looking for, you don't necessarily want to go out to the office, we do have that option for you. And our website is www.nittany.com if you want to check that out. We'll move on to the next question here. Let's see. I'm hearing more about convergence insufficiency. Can you please elaborate?
Yeah, you know, Rachel, we might want to set up a webinar just on vision and learning and talk about convergence insufficiency. It is a big diagnosis right now, especially with regard to kids. It's very common to pop up between second and fifth grade. but yet it can also happen with regard to adults. What's happening is the eyes aren't teaming together as comfortably and being able to maintain that control during near tasks. And so it can cause everything from symptomatology that may be misdiagnosed with attention deficit disorder when it's really not, to double vision, to rereading material to get meaning out of it, losing their place, words look like they jump, move around on the screen. You know, like I said, that's sort of a lecture in itself, but because it's muscles, eye exercises can be done to tone up those particular muscles. Rachel, we might want to put that on to do a vision and learning webinar in the future.
I absolutely agree. It's a very detailed topic. I know you've given us a education on convergence insufficiency before, and it was very
yes.
So
yes.
absolutely.
Yeah, and if you want to just email me who asked that question, you can email me. My email's right there at drmoon@nittany.com, and I can get some additional information back to you as well. But it sounds like we need to do a webinar on vision and learning where we can talk about that.
Absolutely agree, Dr. Moon. So we have about 5 minutes left for questions. So I'm going to ask a few more for you. Anyone else, please send them over. You can email Dr. Moon directly, or you can email marketing@nittany.com, and we will make sure those questions get answered for you. But we don't want to take up all of your morning here. So we will move on just a couple more. Can you touch a little bit on dry eye and vision loss? Is there a concern relating the two?
Well, yeah, individuals of all ages we're finding have ocular surface dysfunction. We're sort of going away from the dry eye term because there's so much more than just the amount of tears not being produced at a level that needs to be. But usually it does not cause a low vision situation unless the cornea, the outside covering of the eye, is compromised. And I would hope that an individual would have gone to an eye doctor long before that. But if it's properly managed with all the different options that we now have available for managing ocular surface dysfunction, or what used to be and sometimes individuals still refer to as dry eye, that should not occur. But if the cornea does start to break down and compromise, that's when low vision can occur. But that's a very, very advanced, and like I said, an individual who has not been managed.
Thank you for that, Dr. Moon. Are there any assistive devices which are better to be used for children versus the elderly?
No, not really. I mean, when I'm doing my low vision rehabilitation evaluations, I pretty much customize it based upon what the individual's needs are. So there are some devices that are being used by an 8-year-old that an 80-year-old patient's using, and vice versa. There may be things that the 8-year-old's using that the 80-year-old is not using. So yeah, I really customize it based upon the individual's level of vision that they have and what the goals are.
Thank you for that, Dr. Moon. So last question here. Let me see. Can you touch on ocular migraines?
Well, first thing we look at aspect when I'm evaluating a patient is to make sure that before I put the diagnosis of ocular migraines on, make sure there's nothing else going on. There's nothing else systemically going on. So we're going to make that assumption. The patient is not in a pre-stroke situation, or we don't have high blood pressure. So we'll say, okay, all those things are normal and we just have ocular migraines. Then we start looking at what seems to be a trigger. Is there a particular thing that tends to trigger it? Is it a stressor? Is it something an individual ate? Is it something an individual is exposed to? Is it something related to sleep patterns? So we look at those kind of things. And then as far as management aspect is concerned, you know, if it is one of those environmental things that tend to be causing that, try to avoid those particular things. Then we also look at, those are individuals that tend to be a little bit more glare light sensitivity issues. So we'll many times recommend a filter light sensitivity evaluation to see if they can have some relief with regard to that. That's primarily what we're looking at, is trying to separate out, is there a systemic health thing, or is it just purely an ocular migraine with the visual aura? We also, with regard to those as well too, some of the signs and symptoms associated with ocular migraines, we also have to make sure that the retina, the inner lining of the eye, is also intact as well, because sometimes that can be an early, similar symptoms can be an early sign of a retinal tear or retinal detachment occurring. So those are things that have to be ruled out first.
Thank you. And last question here, just want to focus, this is really relevant for right now. Given the concerns about COVID-19, how would you do assessments with filtered lenses?
Well, we have a whole protocol that's going on right now in our optics department with regard to cleaning and disinfecting, and how even frames are just being presented. So it falls into the same category. The filters have to be cleaned and disinfected before each presentation. So we are able to do that with our specialized trained opticians that have been trained in that area of doing filter and evaluations.
Wonderful. Thank you so much. I know that is a really big concern right now, but we do have a lot of protocols in place, keeping our office clean and keeping everyone safe that is coming in. I think that kind of wraps it up. We do still have some more questions, but we do not want to take all your guys' time this morning. So if you do have a question that was not answered, please email, like I said, either Dr. Moon, and her email is on the screen, or you can also email marketing@Nittany, and we will get your questions answered. Thank you all for joining us today, and thank you, Dr. Moon, for that wonderful webinar.
Yeah, thank you all for attending as well, and stay safe and stay healthy.